So much for the opportunity to be here with you all. I'm Enrique Castro-Sánchez, and as Nina said, I'm going to give you like a quick overview, like a hands-on practical session on how to use the ICROMS tool. And you may see the benefit of using a tool like this one as a reviewer, but also if you are carrying out your own research reviews. So let me share my screen and very much hope that everybody can hear me okay. And let's take it from there. If anyone could let me know if you can see my screen okay.
No, Dr. Enrique, we cannot see your screen.
How about now? Can you see my screen?
We cannot see your presentation.
Okay.
Yeah, it's coming up. Yeah. Yeah, we
Okay.
got it. Thank you.
Fantastic. Thank you. Sorry. So this is a practical session on the use of ICROMS as a quality assessment tool. So you may be thinking, hang on, why would anyone want to develop a new quality criteria when we've already been taught about Prisma and several other tools that you can see in many other places? Well, you know, as you know, often reviews just focus on randomized controlled trials, which they are assumed to be the highest level of, or they assume to offer the highest level of quality. And that may be the case if you can carry out the reviews, but in many disciplines, in many fields, you know, it is really not possible to carry out a randomized controlled trial. And infection prevention and control, which is my field, and antimicrobial stewardship, it is really uncommon to be able to carry out the randomized controlled trial. So we trade off quality and feasibility. And because of that, we need to use different tools to appraise the different studies that we can draw evidence from. You also may need to quite quickly assess the quality of multiple study designs. So, you know, you may be thinking, well, I have to have an opinion about a particular topic, and I see quite a few studies which may be relevant. And then, you know, what can you use to draw a conclusion about what the evidence says? And in many tools, you will see that qualitative studies are often excluded. And that just reflects the views that, you know, many people, many researchers have about the position of qualitative studies and qualitative evidence. So when we developed the ICROMS tool, we had the view that all sources of evidence can bring something to the table, and it's worth having some kind of objective measure of any strengths, but also weaknesses. That's thinking about your role as researchers, but as peer reviewers, remember that you've been already giving fantastic pieces of information about, you know, the job is to assess the novelty in the journals which focus on novelty. You definitely need to assess the quality, and also you need to know how that paper fits in the narrative, in the tradition of the journal. And as a peer reviewer, you may be quite expert in the technical aspect of a paper. You may be also quite expert in the content of the paper. You may be quite familiar with the literature, so you know if it's new or not, the novelty aspect. But sometimes you're not that expert in either of those sort of disciplines. So you may be quite expert in method, but not the content, or the other way around. And as a peer reviewer, it is really useful, or it may be really useful, to be able to appraise quality rapidly. Also, as a researcher, it's quite useful, or it may be quite useful, to use the ICROMS tool to appraise your own paper before submitting it to a journal. So you can see if you need to strengthen a particular section of the paper because it may not be completely clear. So the job of our paper, it's to entice the reader, but even before that, you need to entice the editor, and you need to also convince the reviewer that your paper is technically sound and novel. So these are some of the, in my opinion, some of the reasons why using ICROMS will be useful. So you have got the ICROMS paper in front of you, very much hope, and you have had a chance to look at it. But essentially, ICROMS is a system, and it's a systematic approach to appraise the quality of a paper. And before going into it, I will clarify that with ICROMS, traditionally, you will score the paper, and depending on the score, you will reject it and not include it in your review. But as a reviewer, you will not do that with the paper. You will use ICROMS to see the strengths and weaknesses of that paper, but you will not use the tool to reject the paper. It's just to offer you information about areas where things may not be that well explained, or there may be some flaws. So I just wanted to have that, in advance. So the ICROMS is a system, it's a systematic approach, and this system has got two key features. The first one is it includes a scoring system with generic quality criteria and study-specific quality criteria. So all papers have to meet some criteria which are generic, but also specific to the type of study that you are evaluating. The studies that Nina and Rahila have mentioned before. The other element of the ICROMS is that it includes a decision matrix that really tells you about the minimum requirements that each study type must meet. So you score, and then you see if the scoring achieves a certain threshold. Okay, so I do like it because it's systematic. I do like it because it's easy in the sense that everything is quite explicit, it's quite clear, and that it's useful to go through the key elements of a paper. Some of the elements that they have been mentioned before, but in a systematic way. Okay, so happy with that, scoring and decision matrix. When you have a look at the table that's included in the paper, or you will see later that we have, it's possible to use an Excel or a web platform. But when you have a look at the table of the ICROMS paper, thinking about the scoring system, you will see that there are some dimensions. So within the quality criteria, you will see that there are some broad dimensions, and then each dimension has got some specific criteria, some sub-dimensions, if you want to put it that way. The 7 broad dimensions that each paper needs to consider, or that we will consider for each paper, are here. And in a way, they make sense, and they kind of put together quite a few, if not all, of the things which have been mentioned before. So, a paper must have clear aims and justification. They must show how they've managed bias in sampling or between the groups. They must show how they manage bias in outcome measures and blinding. So those are the more technical approaches. They also have to show how they manage the bias in the follow-up and the bias in any other aspect of the study. There are 2 further dimensions. One of them is how well the analysis has been conducted. That's dimension 6, about the analytical rigor. And finally, the authors have to demonstrate how they've managed any bias in their reporting and ethical considerations. So if you think about it, you have got here something about the justification, which is why have they conducted this study? What was the need? This is about the introduction and the background. Then 2 to 6 is about methods and analysis. And then finally, number 7 is that reporting, that discussion that the first speaker emphasize about limitations, and how it had to be an honest and open acknowledgement of the limitations of the paper. So you see, very systematic dimensions, and each of those 7 dimensions has got sub-dimensions, specific criteria. The thing to remember as well about ICROMS is that it doesn't claim to be able to score all types of study designs, but when we created the tool, we really thought about which were the most frequently used study designs out there. So if you look at the study design section, you can go, I like to see it like going from one extreme to the other. If you look at the left, you've got randomized controlled trials and also cluster randomized controlled trials, which are kind of combined thinking about their design. All the way to the right, you've got qualitative studies. And in between, you've got CBA, control before and after. And then a couple of columns to the right, you've got NCBA, non-controlled before and after studies. And then you've got controlled interrupted time series and non-controlled interrupted time series, so CITS and NCITS. And you can see how probably we cannot think of typical designs which will not be assessed by these designs. Okay, you will see if you have a look at the columns that each column has got some symbols. So the 2 ticks are mandatory, is a mandatory criteria. So all studies must report clearly the aims of the research. And then you see that some of the columns, you can have a look at the CITS column, the third from the left. At the top, you see that specific criteria B has got 1 tick. So for that study design, when you see 1 tick in a particular study design, that means that for that study, that's not a mandatory criteria, but it has to be assessed for the scoring system that I'll show you in a minute. So again, very systematic, quality criteria, 7 dimensions, specific criteria, sub-dimensions that some studies have to meet or not, and then assessing which kind of study design you have to decide, well, can I use ICROMS or not? Okay, and that was just the example of thinking specifically about qualitative studies, which will be the foundation of the exercise that we will be doing all along. So you can see how there are 2 ticks, as with all study designs, with the clear statement of the aims of the research. And for qualitative studies, we don't need to worry about anything else until the specific criteria 1D, appropriateness of qualitative methodology. And it's obvious that the other study designs do not need to report, they don't need to bother about that criteria because they don't use a qualitative methodology. And then for qualitative designs, the next specific criteria within that dimension is that an appropriate study design is justified. I'll show you later on in detail each of those categories for qualitative studies. So I hope it's all sort of clear up until now. You've got these, this is the first half of the ICROMS, so the quality criteria per study design. And as I said before, then you've got the decision matrix. And the decision matrix is handy because it tells you what are the mandatory criteria for each of the study designs, which you've got on the left. And we decided, and actually the process of creating the ICROMS wasn't just a group of researchers deciding. We went through a literature review. We also went through a Delphi with experts, and we validated this design against a literature review that we were commissioned to carry out. But anyway, so you got a column on the left, study designs, and then you got the mandatory criteria for each study design. This means mandatory criteria that if the study doesn't have high quality reporting on that particular criteria, then you could exclude this study if you were doing a review. But remember that as peer review, you don't exclude anything. So mandatory criteria, you can see that each study design has got a slightly different mandatory criteria, which makes sense. And then to the next column, the minimum score is the score that the study has to achieve in the study specific criteria. It will become clear once we do the exercise. So again, you see how the first table tells you the how and the what, and the second table tells you the scoring that is required and is the minimum. So now it will be a matter of going through the study and exploring how well they score. And you've got here the reminder that studies must meet mandatory, and then they must also meet a minimum score. And if you were doing a review, you will first of all evaluate if the paper is directly related to the aims of your review. So if you were reviewing the effectiveness of an intervention to improve hand hygiene, for example, you would only include papers which were focused on that particular aim. That kind of makes sense. If you had a look at the ICROMS development paper, you will see that we went to great length to be very clear about the yes criteria, the no criteria, and the unclear criteria. So when we said before that papers had to meet certain mandatory criteria, you may be thinking, well, actually, what do you mean by that? Okay, so, you can see the top row that all study designs must meet quality criteria 1A. And the specific statement was, is there a clear statement of the aims of the research? So how do you answer that? So we define a yes criteria as the goals of the research in the paper were clearly articulated. So they were clearly mentioned. The no criteria, so a paper which will not meet that criteria, would be a paper where the goals are not specified. And then, of course, the unclear criteria will be something in between. So there is a goal, but it's not clearly articulated. It's not clear what the goal is. Okay, so the table in the table 3 in the paper that you've got goes through that detail. Now you could know that by heart, or you could simply use the table or the Excel that's available to go through the quality criteria relevant to the paper and then see how you would score. Now, this is where I sort of throw the first reflection to you. Even if this is a very systematic process, and in a way it's not different to any of the Cochrane approaches, your Anna Briggs approaches, any of the kind of quality assessment, quality appraisals approaches to research, there is an element of subjectivity. And that's why you have got here another difference with a review process. So as a peer reviewer, you're going to be on your own when sort of like building an opinion about the paper. You're not going to be surrounded by other researchers that are going to be conducting a literature review with you. You are review 1 or review 2, review 3. You don't know what the other reviewers have decided. You don't really know how they've arrived at their opinion, but you're going to have to live with that subjective element. So even if we give here these clear aims and justification, someone could argue that the goals of the research are clearly articulated, even with that level of detail. That's still unspecific. What does clearly articulated mean? And I know criteria, the goals of the research are not specified. What does that mean? So as a reviewer, you have to be able to live with that element of uncertainty. You are a technical expert, but it's still your opinion. You are expressing your informed opinion about a particular paper. So there is that subjective element. We've tried to remove as much as possible of that subjectivity from the peer reviewing process, but still there is an element there. So I also just wanted to put that there. So how you use your decision matrix, as I said, section 1, clear justifications, that would be the domain 1. All study designs have to meet that quality criteria, that question, and you've got there kind of the definition. If the paper meets the yes criteria, you give 2 points. If it's a no criteria, 0 points. And if there's something unclear, you give 1 point. And that's how you build that scoring that you saw before. It's clearer here. So remember, this is the decision matrix. So first of all, you have to say, or you have to decide, well, have I got the study design? Has ICROMS got the study design in the table? And then then you need to see, obviously, if you were doing a review, is the paper directly related to the review? That doesn't matter when you're a peer reviewer. And then does the paper meet, as a third step, the mandatory criteria? And finally, does the paper meet the minimum score? Very systematic, which does help if you are having to review papers as part of a group for your literature review, but also as well to justify your decision making to the editor in case there is a large discrepancy, or simply when you are reporting to the editor about the areas that you've considered in the review. So remember what Rahila said, if there is anywhere where you cannot have an opinion because you're an expert, then be explicit, be clear about that. But otherwise, you could use the ICROMS to structure your reporting. So this is the crash course about the tool. And now is where we are going to putting it all together. And very much hope that you also have had a look at the paper by this author, Castro-Sánchez et al. And imagine that you are a peer reviewer for a journal, and you have received a request from the editor to review the manuscript, and you're wondering whether this new tool that you heard about in a capacity development workshop in Pakistan, if this ICROMS tool will be any good for this job. So this is where I need your help, and this is where I'm going to give you some time to not just go through the different sections of the paper, which may be relevant, but also to hear your opinion. So as a reviewer, what would be the first thing that you would do if you had this paper? And I've sort of presented here the submitted version of the paper, which is titled Fragmentation of Care Threatens Patient Safety in Peripheral Vascular Catheter Management in Acute Care, a Qualitative Study. What would be the first thing that you would do? Over to you to let me know. And obviously remembering the steps that I've suggested that you carry out. Any volunteers to say what they would do first? Anyone willing to sort of say what they would do? This is a practical session, remember.
Can you hear me?
Yeah, very well.
Am I audible?
Yeah, I can hear very well.
Okay. So I'm Fawzia, one of the participants in this workshop, and I want to answer this question. I think first I would like to know whether I'm expert in this area or not before I start reviewing the paper.
That is fantastic. That is fantastic. Let's assume that you are an expert either in the methodology or the technical aspect of it. So you are
so then,
an expert
I mean, we can follow that the same metrics and the standard that you already told us, like study design, content, new gap in the literature and gap in the research that's going to impact.
Excellent. I mean, that makes sense. But thinking about the ICROMS tool, what would be the first thing that you would do if you wanted to apply this tool to this paper?
Okay, so I'm handing over to my colleague, Dr. Rubab. You want to add something?
I will see that is it a quantitative study, whether definitely if it would be a quantitative study, then I will take help from ICROMS, and then according to the given criteria that which type of trial RCT or whatever, which criteria are applied to this specific quantitative study design.
Fantastic, fantastic. So, I mean, the title of the paper gives you away all the information you need. The first thing you need to do, or you will need to do, is to check that ICROMS has actually got a criteria for the study designing questions. So, you know, ICROMS has got a section for qualitative papers. And as the title of the paper says, this is a qualitative study. So you can tick the box saying, well, I can use the ICROMS tool, so we can continue. Now that we know that we can use ICROMS, now that we know that this is a qualitative study, would you remember what the mandatory criteria were for qualitative studies? So remember, if you were doing a review, these will be the criteria which the study will have to meet to be accepted. But as a peer reviewer for a journal, you don't have to exclude or include the paper. You just want to see if the paper will meet the minimum. So what were the mandatory criteria? You've got some options here, and very happy if people want to put them in the chat if they're online. Very happy if people want to just sort of, you know, raise their hand or come to the microphone to offer a guess. I've put there some of the criteria, and you've got the right, well, you may have the right option there or not.
Well, can you hear me?
Yeah, very well.
Yeah, so as you have put in on the slide as well, we start with 1A, and I think pertaining to the response that was given earlier, I mean, for any of these studies, we would start with the aims and objectives first. So we would look at if the aims and objectives were stated clearly, and then we would follow with the rest of the checklist. I believe that's the idea.
That you've started very well. You could have continued a bit more. Anyone else would like? So definitely we've got 1A, as all studies have to meet that one. How about the other? So we know it's going to be either, or it could be option A, or it could be option C, option D, or option E.
Option E.
Someone says option E.
No.
Okay. Okay. Let me help you here. So remember the table right at the bottom, qualitative studies mandatory criteria. So 1A, 1E, and 2F. Okay, so the question will be, or the right answer will be option D, 1A, 1E, and 2F. So those are the mandatory criteria that qualitative studies must have. Now, moving on to the more specific domains for qualitative studies, you have got here the definition of the mandatory criteria 1.8. So is there a clear statement of the aims of the research? If you have a look at the paper, you have got the paper in front of you. This is where you have to decide if you would give the paper 2 points if you said yes, there was a clear statement of the aims, 0 points if there was no clear statement of the aims of the research, or just 1 point if the aims of the research were kind of there but not completely clear. So have a look at the paper, the fragmentation of care paper, the paper that you are meant to be reviewing, and see if you can find the aims of the research somewhere, and how well that section is, if it is there. And then I will answer this query which I've received.
It does.
So And yeah, go ahead, sorry. So you say that's, would you be able to mention where you found the information about these criteria?
Yeah, on page 2, under the heading of introduction. In the end, it says here we report the findings of a qualitative study to explore the attitudes, beliefs, and perceived barriers, and so on and so forth.
Fantastic, fantastic. So you can see on the screen that, you know, we managed to get there together. So as it was, and I do think that this statement is clear, you know, the reported finding a qualitative study to explore the attitudes, beliefs, perceived barriers. We cannot read that the aims of the research are, but as a reviewer, we can get that sense. So I agree, so yes, so that's 2 points. And before moving on to the next one, someone says, in which way ICROMS is superior or better than other critical appraisal tools? And I don't think that it is superior or better technically, but it is better in the sense that within the same tool, you can evaluate quite a wide range of studies. So the tools that normally you have available in the Equator or other approaches are design specific. So if you wanted to review a broad body of literature with different study designs, then you will have to be using different tools, which, you know, it just made me more work and effort in a way. So the ICROMS may not be as a design specific, but it offers much more flexibility, and that's why I kind of prefer. And I should say that the ICROMS has been used broadly by the World Health Organization in quite a few reviews and by many other researchers, as it offers that flexibility, but I wouldn't say it's superior or better in terms of technically. I hope that helps. So criteria 1A met, 2 points. How about criteria 1E? So is the study design appropriate to address the aims of the research? So the aims of the research, remember, were to explore the attitudes, beliefs, barriers of recommended best practice around vascular catheters. So we wanted to explore attitudes, beliefs, and perceived barriers, and the authors use a qualitative study. So would you be able to suggest, you know, does the study design, is it appropriate for these aims? Is a qualitative study appropriate for the aims? And did the authors make it clear why that was the case?
Yes, I think the study design is clear. Qualitative study design is mostly used for the assessment of belief and perception of the people, and the objective of this study is the primary investigator wants the basically perception and beliefs of the people. So a qualitative study design is appropriate here.
Fantastic. And in the paper, do the authors make the case for a qualitative design? Like, do they argue that they are using the right approach? Because I agree with you that, you know, qualitative designs are optimal to explore behaviors. So I agree with you, but you know, as a peer reviewer, my job is to see if the authors make the case for the study design which they've used. Of course, they can use any study design they wish, but they need to make the case for it. So did you have a chance to find out about how well the authors made the case for it? I could let me help you. So the definition of that subdomain. So the mandatory criteria is the study design appropriate to address the aims of the research. And for us to be able to give 2 points, for us to be able to say, yes, all of the following items have to be in the paper. So the authors must provide a clear description of the study design. So in this paper, if you go to the data collection section, you will see that, the authors, I'm just reading, they say semi-structured face-to-face interviews were conducted, blah, blah, blah. So there is a clear description of the study design in that paragraph, so we can tick that box. Then the authors must also justify the study design in light of the aims of the research. So towards the just before or right at the top of the paragraph, it says the aim to explore the attitudes, beliefs, perceived barriers. So you've got there, they justify the study design. And finally, the study design is appropriate to address the research aims. And you've got there the analysis section or the analysis paragraph, where there is the explanation about the thematic analysis and how they went about. So because we could tick the box, those 3 boxes, then we can actually say that the mandatory criteria 1E was met. So that's a yes. So that's 2 points. You're getting an idea about how the process goes, isn't it? You literally just go through the criteria and then see how much or how well the definition is met. And that allows you to give a couple of points. Let's do one more exercise and then I'll move on to the sort of rest of the session. So, mandatory criteria 2F. So was it met? And this mandatory criteria is about sampling and recruitment was appropriate to the aims of the research. So where would you be inclined to have a look in the paper to find about the sampling and recruitment? Where would you look at?
Participant selection and recruitment.
Excellent, excellent. So would you give 2 points, 1 point, 0 points to this paper in this section?
I believe it's quite well written because they have identified who they included, and then they are talking about these strata as well. So it's quite comprehensive.
Thank you. And actually that comprehensiveness in the definition of the mandatory criteria, what we're looking for is that the authors discuss the sample frame and approach to recruitment. So where were the people, the participants, the potential participants coming from? And they also had to either tell us about the sampling theory or explain how the participants were selected, or tell us about any difficulties and whether the sample or whether the sample was sufficient or representative. So, people had to do one definite thing, discuss the sample frame and approach, and they could do a few other things. And all that information, if you have a look at the participant selection and recruitment, you've got it there. And because all those items were there, or the necessary items were there, then we can say that this criteria was met, or this criterion was met, and that's a yes, and that's 2 points. So going back to our decision matrix, you see how it's sort of very systematic. Study design, qualitative, it is in the ICROMS tool, so we can move to the next step, which is the mandatory criteria. Mandatory criteria 1A, 1E, and 2F were met. So you can see another tick box. And because the 3 of them were met, and you get 2 points per criterion, and we already have got 6 points. You can see how qualitative studies must meet 16 points. So we already have got 6, and we need further 10 from the study specific criteria to be able to say, okay, this study has got enough quality to be considered. Remember, if we were doing a review, like a literature review, as a peer reviewer, you will include or admit the study anyway. So let me give you some quick information about the other study-specific criteria. And not all the study designs will consider the same elements, but thinking about the qualitative studies, again, this is a specific criteria 1D. And if you have a look at the analysis section, the qualitative methodology is justified, so it will get a couple of points. Specific criteria 3F, are the primary outcome measures reliable? And in this case, the paper, it's either unclear or a yes, depending on the person evaluating. So you may give 2 points or 1 point for this section, or maybe not even a point. And you can see how the paper does not report at all on reliability, which is, I would admit, is a bit weird. And in a qualitative study, we will offer a percentage of reliability because we will achieve a consensus perhaps in the coding or the theme analysis and sort of the analytical aspect. And the paper doesn't offer any information about whether the outcomes of the study were checked with informants or participants and so on. So, I'll move on quickly as you will have the slides anyway. So tallying up the score, you can see that study specific section, the paper gets 16 points, and therefore 6 points from before, 16 points from the study specific. So that's way more than that it will be needed to include this study. And it will also give you an idea as a peer reviewer. You will be able to see the areas where the study could perform better, which will be helpful for you to offer comments as a reviewer. And remember what Helen said before, try to be helpful. It's not about highlighting the negatives. The job is to say, these could be better, and also these could be better doing what? And the ICROMS quite easily allows you to do that, to be that helpful, to be that useful. So the next version of the paper is much better. That's the job really of our review. So again, you see, you got the specific points, and just coming to an end, the other element which I find it's really useful is that this criteria can be included in an Excel, and you can also use some web platforms. So the scoring is fairly automatic, and the platform can tell you the points that a paper has achieved and the areas where it's not achieving the necessary ones. So you can quite quickly do at least that initial scoring of a paper. I suppose that for me it was useful to, at the end of this crash course on ICROMS, to ask you, how you felt about scoring. And I know that you may have just done it for a couple of minutes and not long, but I think it's useful to think about how we feel about the scoring of a paper, how we get to a decision about elements of a paper. Also, as new users of the tool, if you found the quality statements clear enough, maybe you didn't have a chance right now to go through the quality statements, but if you have a look at the paper, I will be very happy to hear about your opinion about how clear they were. And also something to bear in mind, you may read a paper and get a feeling about the strengths and weaknesses, the quality, the novelty, and how it fits in the journal. But you need to remember that the score is a way of being objective. You still have got your opinion, and I would love to hear how your opinion may be shaped by the score which the paper ends up achieving. Sometimes you read a paper and it's really interesting, it's focusing on a really new area, unexplored area, and however there are important methodological limitations or some limitations in the discussion and so on, and it's always interesting to think about how we are going to put the two sides together, the opinion about the paper with the score achieved by the paper. So those are some reflections that I thought, if someone wanted to offer, quick reflection, it would be great. This is really the end of my presentation, which I accept is being a crash course on ICROMS. But how did you feel about the scoring? How did you feel about having to decide what was 2 points, 1 point, or no points?
So anyone from Karachi venue or Islamabad venue? Anyone from here? Anyone wants to comment? Okay, Dr. Fawzia.
So thank you very much for such a comprehensive session, and I believe it's like within half an hour, the best that we can get it out of this ICROM. So it's like really objective and valuable thing for us to learn for the quality assessment and for the review. Secondly, if we explore it more and we apply that more papers, so we can come up with like, more reflections and more feedback around this software or this quality assessment. The only thing that came into my mind so far, what if we have discrepancy? For example, 2 independent reviewers use ICROM and they have different score for the same paper. So how we can address that?
Thank you ever so much for the reflection, and that's really useful. So when any tool is used by a group of people, what we need to make sure is that people see things in the same way. So to do that, people need to be trained. They need to, let's see, if we were working in a team, in a research team, we will get a paper and then not only give the score, but also talk about how we arrived to the score. So you see, that was that subjective element that I mentioned before. You may say things are clear, and I may say, well, they're not that clear. What do you mean? And we will come to some kind of consensus. I get to know what you value and how you do things, how you score papers, and you will get to know my opinion. So it's not different to what we do, for example, with I'm just thinking about hand hygiene trainings, when we train people to evaluate how well people wash their hands, and we have to sort of make sure everybody's on the same page. All the other, Cochrane, Joanna Briggs, and any other quality assessment, quality appraisal tool goes through the same process. So we don't just give people the tool, we also give them some training about how to use, and we also tell them what is it that we expect them to score, high, medium, or low. But it's not uncommon that people have got some discrepancy. You would worry if there are, gaps which are probably more than 20% or 2 standard deviations in the scoring kind of thing, as we will do with exams in the university. I hope that makes sense.
Thank you. My question is that this study is done in 2010 and between 2010 and 2011 and published in 2014. So as a reviewer, what should be my insight and my response between the period of study conducting the study and publication?
So thank you. That's I suppose you will need to have a look at when the paper was submitted to the journal, and I hope that you haven't been there, all of you, where you submit a paper to a journal and it may take 6 to 12 months for the whole process to happen. The first opinion, then reviews, another set of reviews, then the final opinion. It quite easily could take 9 months for a paper to be published from submission. You may have collected the data, say January 2011, and then it may take a few months for you to analyze, to write and submit. So that doesn't necessarily mean the paper is not good. I always sort of keep in mind, has the literature changed enough for the paper not to be relevant anymore? I had some comments from my reviewer telling me that I had not included some literature from, say, 2021 on a paper that I submitted in 2020. And, you know, they were telling me, you haven't included a paper or this particular paper. And you know, it was a bit difficult to say I couldn't have included the paper because I submitted my paper before the paper that you want me to include was published. You know, so don't look at the year and thinking, oh, there's a 3-year gap, the paper is bad. Think about, is there anything in the new literature that I can suggest to the authors to include if appropriate, and something like that. Any final question? Because I don't want to delay anything.
I'm Dr. Farouk. I have a question.
Oh yeah, thank
how
you.
Sum up the scoring of the reviewers? Like if there are 5 reviewers and 3 are giving passing marks and 2 are not giving, then how it is done?
So that's the thing. So with that, if you were using the ICROMS for a literature review where you've got 5 people, for example, then obviously with ICROMS, if the paper doesn't achieve a certain number of points, it will be excluded from the literature review. So you're going to have 3 situations. Imagine the 2 reviewers agree that the paper is in, the 2 reviewers agree that the paper is out, and the 3rd situation is where the reviewers have got different opinion, but the points themselves don't tell you, if a paper gets 20, 24, 26 points, it doesn't mean that it's better or worse than a different paper. And it doesn't mean that we average your points and my points. If there is a discrepancy, the right thing to do would be to catch up with the other reviewer and say, okay, so you gave 2 points here and I gave 0 points in the same category. How did you get to your decision? And how did I get to my decision? So it's just a way, ICROMS is a good way to say the paper doesn't have enough quality to be included. And that's one main difference with other quality appraisal tools. No other quality appraisal tool excludes paper based on their quality. They remember that they say all papers are included and their evidence is considered in the light of the limitations. So a poor quality paper, the evidence will be seen in a certain way, but that paper will not be excluded. With ICROMS, we felt that if a paper doesn't achieve the minimum score, the quality is not enough, so we will exclude the paper. I hope that makes sense. Did that answer your question?
Yeah, thank you so much. Thank you.
Thank you ever so much. Thank you.
Dr. Rahila here comes from
hello.
Thank you very much for wonderful presentation and wonderful discussion. My background is that I'm a specialist of health profession education. So my question is that you have mentioned the criteria ICROMS. So can we use this criteria to assess the articles in health profession education?
Thank you for that question. That's really interesting. So ICROMS focuses on methodologies rather than topics. So if the health profession education is about, say that the study has got a qualitative design, use ICROMS. If there is a random, fantastic. Then there is no problem. It's not content specific, it's design specific.
Okay, thank you.